This is News Today with Mika Mini Nyamani Amana. Now, the Noguchi Memorial Institute is expected to release results of Ghana's 38th suspected Ebola case on Wednesday. This follows the submission of blood samples of Nigerian who reported to the Achimota Hospital on Sunday with severe hemorrhagic fever. The head of surveillance of disease of the Ghana Health Service, Dr. Badusa Akodie, said the service is closely monitoring the situation. Ghana has investigated already 37 suspected Ebola cases, but all turned out to be negative. Ebola has claimed over 2,000 lives in 4 West African countries. But now, Chairman of the Economic Community for West African Countries, President John Dramani Mahama of Ghana, is visiting the 3 West African countries hardest hit by the outbreak of the Ebola virus. The one-day visit will enable him to hold discussions with his colleague heads of state on available sub-regional and international interventions to support efforts aimed at containing and managing the outbreak. Some countries and airline operators have banned flights into the 3 countries, Liberia, Sierra Leone and Guinea, despite several warnings from the World Health Organization. How important is this visit? What implications does it have for the first man of this land, John Dramani Mahama? We'll discuss that over the next few minutes. Dr. Opoku is political scientist with the University of Ghana. He's joined me over the telephone. Also over the telephone is David Agbe. David Agbe is Executive Director for the Ghana Institute of Governance and Security. Welcome to the program, gentlemen.
Yes, thank you so much, Kamani.
I'm going to start off with you, Dr. Adu. How important is this journey the president is embarking on?
You mean how important is the visit by the president?
Absolutely.
Yeah, well, it's quite important, because this recent outbreak of Ebola is more or less, wiping out. In the case of Liberia, the whole generation is being wiped out and it's spreading very fast. And if you recall, some 15 of their cabinet members have left the country and are refusing to come back. So it's getting to a crisis level. So it's important that the president of Ghana and also as the leader of the ECOWAS, he takes a visit there to learn firsthand and also to see how we might strategize to contain this rather deadly spread of Ebola.
David, how about you? In the face of a very deadly disease, infectious disease, how about you? How critical is this visit?
Thank you once again, Kamani. I think that we need to commend the president highly for embarking on this journey. This is the kind of energy that we expect our ECOWAS, chairman needs to be doing. In a sense that when you look at the Ebola, it's such a dangerous, disease, which is more of affecting, our sub-region. And so if the ECOWAS chairman has realized that he needs to tour all these countries to actually console them and also profile something to them, it is quite, beneficial. This president is embarking on how African countries, we can also come out with our own medicine in terms of HIV and other diseases. And so we have been embarking on those journeys in which we think that it is quite crucial and more important for him to do that. If we take a historical look at the way the Ebola emerged as far back in 1976, 1989, even in United States of America, in a country in Virginia, a sub-region called Ricin, they fought it and then it reoccurred. And especially in Africa, you realize that at a point in time, the disease will just go and hide somewhere, and then it resurfaces its head again. And so we need to find a way of getting a medication for this, dangerous disease which is affecting Africa. So it is quite important that the president is embarking on this journey, and it's going to give a certain image of the way the president is carrying itself. So it is quite very much important. If I take you to Germany, there was a disease that happened or that struck Germany as far back 1967 called a Melbourne, epidemic disease, which killed almost about 31 people. And so when you take a historical, background of these kind of, endemic diseases, which is more affecting African countries day by day, it is quite important that the president actually embark on such journey and be able to give more, inspiration and energy to the indigents of those countries.
But gentlemen, talk about the fact that as a country, we are not sure really of the kind of preparation we put in place. Nobody knows for sure because the health officials are saying one story. Government, on the other hand, is giving us one story. You would want to talk about the safety of the president at this point. So let's flip the coin the other side. How safe is our president embarking on these journeys?
I think that the security agencies in those countries, for instance, if you mentioned, Liberia, I have a very strong person there in terms of the military and the police force. They are ever ready and more prepared to protect our president as his entourage. And so security, wise, I think that he will be safe enough. He will also be screened wherever he visits. And so it is more important that he does that on behalf of the country, even though if something even occurs, he has embarked on a journey to save the image of, the West African sub-region. So it is more important that he does that. Making sure that he gives a certain message to the people, and that gives a certain level of confidence to the people that this is a disease, epidemic, which is engulfing, the sub-region. And so we need to find a medication. We need to find an antidote for it. I was giving you a scenario which happened
Dr. Edu, Dave, I'm going to have you hold on. Dr. Edu, this is a country where we've put a cap on international conferences for 3 months, but we haven't managed to put a cap on the number of international visits that the president has to make. You recall the issue of the gentleman from Liberia, Sawyer. Sawyer was screened in Liberia. He was let off the hook, but he infected Nigeria with the virus. Is our president safe? Could we have done this in another way?
Well, nobody is safe, given that this disease spreads through food, contact, and so on. So anything at all is possible. His visit, as a matter of fact, is not going to solve the problem. This is a problem that is medical. And even though it is acquiring political dimension, we need a political will and a political leadership to deal with it. It's a problem, again, that goes beyond simply our politicians. The World Health Organization in the last 50 years has not been able to deal with some of the epidemics like HIV and like Ebola that is wiping out a lot of people. Having said that, let me say that the president's visit, in my opinion, is simply going to enable him as the leader of ECOWAS to coordinate and strategize as to how to deal with this problem now and in the years to come. He has to be very careful where he's going to visit. As I told you, in Liberia, about 15 cabinet members who sought permission to travel outside the country have refused to come back. It's part of warnings from Charlie. So it's a very dangerous situation. And I think the president himself, as our leader, ought to be extremely careful as the contact he makes and so on and so forth. But this is not...
Could this meeting of any sort have been done in another way? Could the president have had whatever information he needed another way?
Indeed, yes. It's not been very possible. In today's world of information technology and so on, they could still be speaking to his counterparts in these countries without physically being there. And he could also, be talking to the World Health Organization, which is involved in all these countries and coordinating the affairs of these countries. If he decides to go there, fine. But I think that his handlers ought to have made it clear to him that it is very, very dangerous to go to a country where this disease is wiping out. In fact, the latest report we have from Monrovia says that it is wiping out a whole generation of people. And so he's taking a very bold step. He needs to be careful, and you all pray for him.
Once the president if the president is infected with the virus, so is the rest of the country. David, should we screen our man when he steps foot here after his one-day visit?
Of course, but I just want to add that what he is embarking on is what we will call justice beyond national boundaries. You know, the president has that mandate and has that responsibility to do justice beyond our national boundaries. In terms of Ghana, he is the ECOWAS, a president for now. So anything that is, striking and affecting Liberia, Congo, other countries, the president needs to be well involved, needs to actually take the bull by the horn and champion a certain cause that will give an inspiration to our continent.
I see. So, David, I'm going to let you go off at this point. I'm totally grateful you could join me here on News Today. And well, in a bit, we should have the deputy communications minister over the telephone. Let's find out how safe our president is. Dr. Edu, I was asking, should we screen our president when he comes back?
Yeah, I think we can. I mean, in his own interest and in the interest of people who work with him, we need to screen him, and I'm sure it's going to be done professionally, and it will be done in a very respectable manner. Because he's our president. We need him to be there to do the job we want him to do. He works with other people. He just visited a place where there is an outbreak of a deadly disease. So we have to screen him and do so politely and with all the respect that should have called the president.
But with the danger at hand, if ministers of state in Liberia are running away from their own country and the danger we see, why would the president want to embark on this journey?
Yeah, that's my problem too. That's why I said that's a very bold but dangerous step he's taking. And we should all pray for him, because the reports we are getting from Liberia is one that indicates that the problem is getting out of control. And there are people today who are even saying that Liberia should be put under UN trusteeship, because there's more or less no government in that country. Over half of the cabinet having gone out and refusing to return. So it's not advisable at all for the president to go to that country now. In any case, he's gone there, and so we need to be very careful. He needs to be very careful, and we are hoping that he returns safely to us.
So like the way the Foreign Affairs Ministry managed to put a cap on international conferences here in this country for the next 3 months. 3 months we started counting already. Could we have done the same with the president's visits, including his international assignment as ECOWAS chair? Yeah,
I mean, it's very contradictory for you to refuse people from these countries to come here for a conference in 3 months, and yet in the next breath, you deciding to go and visit those countries to learn about what is happening there. That is quite contradictory. I think it's a very dangerous move, and even though a very courageous one, and I think whoever is advising him, national security ought to have advised him against going there now.
So is it possible for us to restrict his movement? I mean, the country Ghana to restrict his movement as ECOWAS chair? Is it possible?
Well, yeah, it's possible, because you see, first and foremost, the most important thing is the law of self-preservation. You need to be alive to be able to do the work of a chairman of ECOWAS. So, common sense, and the law of self-preservation teaches us that the president should be safe. The president should be healthy. The president should be strong to be able to do all this. And therefore, it is quite commonsensical, very, very commonsensical for him to for you to tell him, for national security to tell him that in the long-term interest of this country and for your own sake, please don't go to this place. In the first place, you have issued a report that says that people from there cannot have conferences here for some time to come, all in an attempt to prevent the spread of the disease. The question is, why then do you go there? Who advised you to go there? Why take that rather very risky, decision to go there? So nobody is going to restrict him from moving, but the circumstances at the time, the logic of the situation requires that he is restricted.
Dr. Edu, we'll leave it here for now. Thank you very much.
Yeah, thank you.
In a bit, we should get in touch with the Communications Ministry. Let's find out what steps have been put in place to protect President Mahama from any infections whatsoever. You recall that U.S. Liberian citizen Patrick Sawyer got the infection from Liberia, was en route to Nigeria to a high-level meeting. It means that this disease is no respecter of person. If President John Dramani Mahama is infected, the rest of Ghana is. The question now is, how safe is our president? What have his handlers put in place to protect the first man of this land from getting any infection? In the meantime, on Facebook, Oscar Woto late says it's a smart move, Mr. President, God bless you. Meanwhile, Nicole Nelly Kutana is advising the president not to shake hands because a Liberian government official took it to Nigeria. KZ Okiki says, Mahama, hope you're not on a mission to bring Ebola to GH. And Elebi, the boy GH, says, tell him to stay there and he should not come back with an Ebola crisis. The economy is more than the word Ebola. Akoli Samuel says he should be careful not to be affected or infected because before he comes. And Wealthy Evans says if Ebola comes to Ghana, the government will get more money. Bill Gates has donated. I'm not sure what good that is, but those are some of your messages. When I come back, we'll deal with some more stories. Talks with government of Ghana on Tuesday following the oversubscription of Ghana's third Eurobond auction and the Cocoa Board syndicated loan, which brings a combined value of almost $3 billion into the Ghanaian economy. Chairman of the National Development Planning Commission, Professor Kwesi Boche, has been nominated by President John Dramani Mahama to lead government's discussion, which follows a period that many analysts and economists have described as the best week over the last decade. On Thursday, government's attempt to raise $1 billion from the international capital markets was oversubscribed with orders of up to $3 billion, while Cocoa Board signed a $1.7 billion trade finance deal, which was oversubscribed by 15% as well, with a consortium of domestic and international banks for the purchase of cocoa in the 2014-2015 crop season. The Eurobond, due in January 2026, was sold at a coupon rate of 8.125%, which was lower than analysts had expected given the fiscal difficulties faced by the economy, which is expected to boost the country's position as it engages officials of the IMF this week. The timing of the bond is the subject of intense interest, that is, given the imminent IMF talks. Let's talk about food security. The Food and Agriculture Organization monthly food price index registered another drop in August, continuing a 5-month downward run and reaching its lowest level since September 2010. The index's August average of 196.6 points represents a decrease of 7.3%. That is at 3.6% from July. With the exception of meat, prices for all of the commodities measured by the index dipped markedly. According to the index, dairy led the pack, with FAO's sub-index for dairy products averaging 200.8 points in August, down from 25.3 points, that's about 11.2% versus July, and 46.8 points, about 18.9% compared to a year ago. The results of abundant supplies for export coupled with reduced import demand. FAO's price index for cereals averaged 102.5 points in August, down 2.8 points from last month and 24.2 points against August 2013. On here on News Today. Well, time for some sports news. We'll begin with the Black Stars. And the Ghana Football Association last Friday confirmed it had parted ways with Black Stars coach Kwesi Appiah. Kwesi Appiah only in July entered another 2-year deal with the GFA. We spoke with some members of the public on this decision.
I'm sure you might have been following soccer for some time now. Obviously, you might have even followed the Black Stars. You're a Ghanaian. You're a patriot. Yes, so you like Black Stars. You cheer them on. Now, Coach Kwesi Appiah has been given the sack, confirming rumors and speculations over the past week or so. Do you think he was treated fairly?
No, like it's a Ghanaian, and they have to take their time, small. But as for Ghanaians, I don't know. It's about a small program, so they should take their time, and I think it will be pick up. They should not give Kwesi Appiah too much undertaking, like he's a human being. So they have to take their time.
He's been in charge for about 2 or 3 years. Isn't that enough time for you to actually gain roots and know what you are doing?
Although it's a human being, but human beings do make mistakes. So
if the mistakes become one too many, don't you think it's reason enough for people to begin to think that probably you are not the best person for the job?
Maybe the GFA, I saw it in the news that they have not sacked him, although, but they have typed it on their website that he's been dismissed. And I think it's not a good idea for me.
It's not good?
Yes.
But do you think Kwesi Appiah was a good coach?
Yeah, he's a good coach. But